Hi, Doc Martin here. Is sensory integration therapy really an evidence-based practice? A lot of people are confused about the current state of sensory integration therapy. Here are three things that are known for sure. 1, it is the most requested intervention by parents of children with autism. 2, it is rated highly by parents in terms of how helpful it is. And 3, until very recently, the overwhelming consensus of researchers was that it was not an effective approach. Well, all three are true. Parents request it, parents like it, and sensory integration therapy has a long history of being categorized as non-evidence-based. So what is going on? But first, if you like this video, please hit the like and subscribe buttons. I'd really appreciate that. Let me start by talking about what sensory integration is. Specifically, Ayers' sensory integration approach. The therapeutic approach was developed by Ayers, an occupational therapist and a psychologist, in the 1960s and 70s. It was further developed and refined over time by occupational and physical therapists. Now, the information we have about the world comes through our sensory systems. The sensory systems, are there to provide us with input. They include vision, our hearing, our taste, our smell, touch, awareness of our body position, awareness of sensations inside our body, and movement, especially balance. Effective integration of these incoming sensations enables the development of skills like care of self, engagement with people, and participation in social contexts. Now, for most children, sensory integration develops in the course of ordinary childhood activities. Motor planning ability is a natural outcome of this process. But for some children, sensory integration is disordered, and a number of problems in learning, development, or behavior become evident. For example, some children are overly sensitive to sensations like touch, sights, and sounds. They powerfully experience a sensation. Some are underreactive. They may seek out intense experiences like body whirling or crashing into objects. Others may be sensory craving with unusual high activity levels, while some have unusually low activity levels. If a parent suspects the child has a problem in one or more of these areas, the next step is to have an evaluation done by a qualified occupational or physical therapist who is able to deliver evidence-based sensory integration therapy. Now, until recently, the evidence base for sensory integration was poor. Study after study failed to show any benefits. But many of the studies were poorly done, and others failed to follow the principles developed by Dr. Ayers. That picture has changed recently. Both the National Clearinghouse on Evidence-Based Practice and the Council on Exceptional Children now have listed Ayers sensory integration therapy as evidence-based. This approach is a complex intervention, usually done by occupational therapists with specialized training, and takes place in a specially designed clinical setting that offers a safe and sensory-rich experience. And the evidence-based approach has recently been trademarked as Ayers sensory integration to distinguish it from the other sensory integration approaches. Now, many so-called sensory integration interventions do not meet the criteria for evidence-based. Some unproven approaches include touch-based treatments like massage, deep pressure, although Qigong massages has encouraging results but lacks controlled studies. Other approaches like weighted vests and blankets, squeeze machines, auditory interventions, the use of a sensory gym, all lack sufficient evidence to justify their use. While some of these approaches, like the use of a sensory gym, do not appear to work as intended, they may serve as reinforcement and may have other benefits, such as promoting healthy exercise. As such, they could then be considered a leisure activity. And I would also like to note that Ayers sensory integration is not currently appropriate for implementation in classroom settings. Ayers sensory integration, or ASI, takes place in clinical settings. And ASI is only one of several ways to address a child's needs. Other evidence-based practices, like antecedent-based interventions, may be used to address sensory problems. For example, visual, auditory, tactile, or gustatory aversive sensory experiences. Now, for parents who may not be able to access Ayers sensory integration therapy, the question is, what can they do while waiting for services? There are two very good books that can provide guidance and at-home activities. Lucy Miller's Sensational Kids and Carol Kranowitz and Lucy Miller's The Sensational Child, and I have provided links to both below. So, to answer my opening question, is sensory integration therapy evidence-based? If it is the Ayers sensory integration approach, the answer is yes, but only if it is primarily done in a specially designed clinic by a therapist, usually an occupational therapist certified in that approach. My question for you today is, do you have any questions about any other approaches that are marked as evidence-based but may or not really be so? Well, leave me a note in the comments below about any other approaches you're interested in finding out if they have scientific evidence base. I also have one simple request. Could you email me with ideas on important topics that you would like to have me cover? Some of my ideas are how to manage the cycle of meltdowns and tantrums, the truth about timeout, how to help with sleep problems, how to manage eating problems, dealing with going to the doctor or dentist, and any other topics that you might be interested in. I would really like to hear from you on what topics you would like to have me cover. You can leave a link in the comments below, or my email address is managingmeltdowns@yahoo.com. And if you're interested in everything I'm talking about, hit both the like and subscribe buttons and turn on that little bell next to subscribe so that you don't miss out on any of my uploads, because I know you will love them. This channel is being designed especially for you. Take a look at my online Moving Beyond Meltdowns Academy that has two programs for you: a mindfulness program and a healthy eating program designed especially for you, the support provider. Thanks for watching, and please leave any comments you might have or any suggestions for topics you'd like to see covered. I'd really appreciate that. So, see you next time, and just keep on trucking.